I mean, don't get me wrong. The paperwork is not fun. Okay. I don't really, I don't really know any doctor that says they love to do paperwork. And honestly, as a family doctor, we often have a decent amount of paperwork to do. So what am I talking about with paperwork? I don't know, forms to fill out, prior auths to get, but by the way, there are many specialties and specialists that have to do prior auths these days, but I don't think anybody finds those fun either. But yeah, there's often a lot of paperwork that we have to do, and that's not fun. Also, things like working nights and weekends, not always the favorite, but we're not the only ones who do that. As a family doctor, I work one night a week. I also work one weekend per month. Many family doctors, we have sort of different schedules to accommodate patients, which is great for patients. But, even though I mention these things, it's really not the worst thing about being a family doctor. There are annoyances, sometimes more annoying than other times, but the real tough part with being a family doctor um, has to do with patients. And it's this: patients dying. That is by far the hardest part, the worst part about being a family doctor. And I know, if you're not in the medical field, you might be saying, well, that's sort of a part of the deal. And you know what, you're right. And maybe if you are in the medical field, you're saying, Dr. Jen, this is kind of what happens. And you're right too. But I think when I was a resident, I thought it would get easier. I remember, and by the way, I'm telling this story now, not the story about being a resident, but I'm talking about this being the worst part of being a family doctor for me now because I recently had a patient die within the last week, and I'm sort of dealing with, what comes with that. And it's always a very reflective and very sad time for me. I still cry when my patients die. And when I was a resident, which is what I was going to tell you, I don't know. I remember when my first patient died, the first patient I ever pronounced in the ICU. I remember I was an intern, and it was this huge moment for me because number one, I had never been there when a patient had died. I had never pronounced a patient. It was the first time I had witnessed this, and it was huge. And I remember I was there with the nurse, and the family was there, and we were going through stuff. And I remember calling my resident who was in the call room and letting him know what had happened about this patient. He was the resident for the ICU, and I was the intern, so I was on the floors taking care of stuff. And I called him and said, Mr. I'll call him Jones. I said, Mr. Jones just passed, and he said, okay. And I'm thinking to myself, Mr. Jones just passed. Like, and I said it again, like, you must not have heard me. He's like, oh, okay, yeah, that's fine. And I was quiet, and I realized that it didn't seem to affect him the way I felt affected in that moment. I mean, I got a little bit tearful on the phone, and he was like, are you okay? And I then, of course, immediately became embarrassed and hung up the phone quickly and went back to attending to my business. But I cried then. And honestly, every time a patient has died since then, I can't help myself, but I cry. I thought that as I got older, as I got more established as a doctor, as I'd been through this over and over and over again, I thought that it would get easier. I thought it would get better. I thought it would be something that, I could just deal with. Now, also, I'm in family medicine. So I'm in a specialty that's, say, not like ICU medicine, where the rate of people passing away is much higher, or maybe ER, where sort of the rate of trauma and even people passing away is very likely much higher, right? And I'm not a hospitalist at this point. I did hospital medicine in the beginning of my career, and so of course I was a part of people dying much more in a different way. As of this point in my career, I've been practicing for 13 years. I'm an associate professor at a medical school, and I'm an outpatient doctor primarily. Our university practice is just outpatient. It's no easier. Maybe is it because I'm not in the ICU, that I'm not an intensivist, that I'm not a critical care physician, that I'm not an ER doctor? Very likely, very probably. But something tells me that the wuss of me, the wuss in me, probably would cry anyway, to be honest with you. What happens now is, with my patients who are passing away, and like this patient who I literally was on the phone this morning with my staff about, um, that it's transpired in the last week. My patients are like family. Even when I was in the ICU as an intern and doing ER shifts as a resident and things like that, they still felt like people I loved and cared for. And even more so now that I'm an attending and have been for 13 or 14 years. Now I've been at the practice I'm at now at the university for about a little over 10 years. So I've known these people for 10 years or longer. That is a long time. It's enough time to know someone's positive aspects, their negative aspects, to know what they're like when they're scared, when they're happy, when they're sad, when they're mad, to remember when they sold their house, or when they got a new puppy, or when they went through a divorce, or when their child graduated from college. 10 years is enough to know all of these things about people. And that's one of the things that affects how I feel. Once again, I have cried all the time, all through the years, even when I hadn't been seeing patients for 10 years. But I guess I'm saying this to say, first of all, for those of you who are maybe in the medical field, maybe you're a resident or a medical student or what have you, or pre-med, I don't know. I'm just here to let you know it's okay to be upset when a patient dies. I think sometimes there's a lot of pressure to just move on. And there are some specialties in some situations, and many situations very likely, where you do just have to do that. But if you feel sad, that's normal. If you cry or shed a tear, that's normal and that's okay. And know that even as an attending who's been in practice for 13, 14 years, it still happens to me. Also know that you're still a human if you're in the medical field. You're a human no matter what. And losing a human life is really the ultimate, don't you think? So this was important for me to say because I've always been a little bit embarrassed about this aspect of medicine, which is the worst part about being a doctor, being a family doctor, is losing patients. These are patients that you come to know and come to love, and you come to know who they are. They feel like family. So if you feel that way, you're not alone, and that's not wrong either. I think one of the most important things that we can do as healthcare providers is never to lose our compassion. Of course, we want to make sure that we're able to do our jobs and that we're not, that our emotions don't get in the way of our ability to do what we need to do and to function appropriately and successfully and to treat patients adequately and appropriately, right? But it's important to never lose that compassion and to never lose what makes you you on the inside. Remember, it's the compassion that allows you to treat patients that are alive to the best of your ability, and for them to in part receive excellent care. So, as we talk about the worst things about being a doctor, yes, there's the paperwork and the prior auths and the forms and all of this stuff, okay? And the sometimes working on nights and weekends and things like that, which, by the way, to be honest with you, I don't mind working on weekends because the office is quiet. It actually feels like it's like nice and zen. I don't actually mind that. The worst part by far is losing a patient. It always has been for me. It probably always will be. It's definitely the worst. And if you feel that way too, and you're in the medical field, it's okay. You're probably right on track in terms of how you should feel, because this is a big deal. And for those of you who are not physicians, and maybe you're not in the healthcare profession, please know that what happens to you matters to us. It does. What happens to you affects us. Every cancer diagnosis, every terminal illness diagnosis, every diabetes diagnosis, anything that I give affects me just like I know it affects you. And death is probably the hardest. So anyway, I hope that's helpful for any of you listening, whether you're in the medical field or not. No, you're not alone, but patients know that we're with you, and we think about you like we think about our own family. Guys, I'm Dr. Jen Caudle. Thanks for watching and thanks for listening. I do lots of videos on celebrity health. I do videos on COVID. I do videos on general health topics. And I also do videos about the experience of being a doctor. If you like this content, please subscribe to my channel and click the little bell for updates. Guys, I'll see you soon.